her uterus.
Uterus.
Okay. Now, the reason that gets confusing for people is because, so the uterus is where the fetuses develop, right? The reason that gets confusing for people is because in humans, right, we have our uterus and then we have what they call in the doctor's office, they call them fallopian tubes, but that's an old dead white guy name, right? So the better name is uterine tube. And so our ovaries are over here, our ovaries release eggs. They get sucked into the uterine tube and they get carried over to the uterus, all right? Well, in cats, their ovary is right
On the side.
on the tip of their uterus, basically. So do you see this thing that looks like a little tiny bean?
No.
Yeah.
Right? That's one ovary. And then the other ovary is right there.
Oh, okay.
Yeah?
No,
So
no.
they just look like little teeny tiny things. Yeah?
No ovary and tube.
Well, they do have a tube, but it's not as big as it is in humans. So in humans, it's got to carry a distance. But in cats, right, this is their uterus. Their uterus is here. Their ovary is here. So the uterine tube is literally just this little tiny, like, thin flap that's, like, wrapped around the ovary. So it's not really a tube. It's more like a wrapper in cats.
So if you put a
right?
pin on the ovary, we're going to have to label ovary. And then if you put a pin on the little
So if I put a pin in this little thing, you would say uterine tube. If
Okay.
I put a pin in the little thing that looks like a bean, you would say ovary.
Okay.
If I put a pin on here, you would say
Uterus.
uterus. Now, technically, in a cat uterus and other mammals that have litters, right? Their uterus, you might call these the horns because they kind of look like horns, like horns on an animal. So you might call it a uterine horn, but uterus is fine for us since we don't care. Okay, and then the bottom part where the two horns come together is called the body of the uterus, right?
Okay.
So I'm pulling on the urinary bladder so I can see better, right? So the body of the uterus would be right there. Okay, and then the only
It's like
other
a V at the
structure on a
bottom.
female that you need to know is the vagina, and so that there's a couple ways of going about it. One is you poke around on her backside here until you find it. Where is your back? Talk about before. So remember, the urethra is attached to the urinary bladder, and it carries urine outside the body, right? So the urethral opening in cats is right next to the kind of opening of the vagina. So there's only one external opening, right? And then the urinary opening is right sort of just inside of the vaginal opening, okay? But you can feel and you can see, right, that there's this skinny tube here. That's the urethra, right? And then underneath the urethra, there's another tube, and that second tube is the vagina, okay? So that's reproductive part. The other way you can go about dealing with that, if you're interested, is you can cut through all of this muscle, right? And I have bone cutters that you can use to cut through the front of her pelvis, and then you can break her pelvis open, and then you can actually see everything. So if you want to do that, that's fine, right? I'll show you how to do it if any of you are interested. If you're not interested, that's fine too. Okay, so it's up to you. Okay, so that's her reproductive stuff. So we'll find a male and do reproductive structure. Yeah, and so the heart is covered with, often there's some fat on the outside, right? Kind of acts like a cushion, and it just gets stored there. Okay, but there's this baggie. So what is this what's the baggie that I'm pulling on?
Pericardium. The
So it's
vast.
called the pericardial sac
pericardium sac,
sometimes,
yeah.
but it is equivalent to what membrane? What membrane am
The
I cutting?
visceral membrane.
Is it visceral? Is it directly on the surface of the heart?
Oh no. Okay.
No, it's outside,
It's
right?
outside. Right.
Because I can peel it off. It's not, there's space in here. So my scissors are in the pericardial cavity.
Mm-hmm.
So what I'm cutting must be the parietal
Parietal.
pericardium.
Parietal.
Yeah?
Right. What we just learned.
So let me just cut it a little more just so we can kind of... Yeah? So I haven't cut it off, but I cut it away so that I could unwrap. Right? And now here's the heart. And the shiny surface of the heart
That's
is
the
the
visceral.
visceral pericardium.
Pericardium.
Or sometimes called the epicardium. Right? Yeah? Okay. So there's an atrium. There's another atrium right there. They kind of look like earlobes from the outside. And then the two ventricles. You don't need to know heart anatomy on the actual cat heart because it's too small to really figure out. But we will do the sheep hearts a little bit later today. Okay? All right, so let's do blood vessels. So if you look at my blood vessel drawings up there, you know what to expect from me as far as drawings go. It is not particularly to scale, right? But what it does do is those drawings will help you understand branching patterns, okay? And that's kind of an important thing, all right? So this big blue vessel that's coming off the top of the heart, what is that?
It's a vein. It's a flow membrane.
It's not the aorta, because it's blue.
External jugular vein?
No, the jugular should be up higher. That's the
Superior vena cava. Superior vena cava. Superior vena cava. I say vena cava. Superior vena cava. Yeah? So this is the vein that's bringing blood from the head, neck, arms, upper part of the back to the heart. Yeah? So superior vena cava. Right? So find the heart on the blue picture, on the picture with that's drawn in blue. Right? Find the little heart, the little blue heart. Right? And there's a vessel coming out of the top of it, and I wrote SVC because, you know, I'm lazy, but, right? So, yeah, superior vena cava. So then the superior vena cava splits
into
it makes a fork. So what's it splitting into?
The three branches. The
brachiocephalic veins, right? So this would be the right brachiocephalic vein because it's on the cat's right side. This would be the left brachiocephalic vein because it's on the cat's left side. Okay. Now, the only really tricky thing, I'm not even going to say tricky. A thing you need to remember about blood vessels is that you need to remember to use whole names on the practical exam. So you need to say artery or vein. You can't just say, oh, that's the brachiocephalic. The brachiocephalic what? Right? And then, if appropriate, you also need to say right or left. Okay? So, if I wrap a little piece of dental floss around this, right, and put a little tag on it on the exam, and say, what is this vessel? You would say,
right.
Yeah? Okay, so right brachiocephalic vein, which is kind of damaged, so I'm going to focus on the left side. And so on veins, I only labeled the one side on the picture because it's perfectly symmetrical from one side to the other. Well, not perfectly symmetrical, it's mostly symmetrical from one side to the other. So I didn't label the other side, okay? So this is the left brachiocephalic vein, and you'll notice that it branches too. So what are these branches called now? So one of the branches goes up toward the head.
That's the jugular. External.
So that's the external jugular vein.
Left external.
Left external jugular vein, yep. And then the other one kind of goes below the clavicle toward the arm. Left subclavian vein. Yeah? Okay. Now, sometimes you can see the external jugular vein go all the way up, right? It depends on how well it injected when they injected your cats with latex. So it kind of loses steam right around here. This is it. I can tell this is it because I know what I'm looking at, but it's not really well injected. And then on some cats, you'll have a nice transverse jugular vein right here. Yeah, this cat, once again, it didn't get injected, but transverse jugular vein would be right there if you've got one. So if your cat doesn't have one, don't panic. You'd know it if you saw it, right? Transverse jugular vein because it's going transverse. Exactly. Okay. So those are all of the veins above the heart. Now let's do the arteries above the heart. Okay. So whereas the veins were basically symmetrical, the right side is, as similar as you're going to get to the left side. Notice another thing I should mention too is that the only vessels you need to know are the ones that are on the list, which are on my drawing. If you see other stuff and you're like, what is that? Don't worry, just ignore it. Pretend it's not there. Right? You only need to know what's on the list. So ignore anything else that you see. Okay? So we're just looking at really big things. All right? Okay, so let's do arteries that are above the heart. So the artery, the path of blood through the heart. So the big artery that's carrying blood, right, is aorta. Okay, so look at my red drawing. So do you see the little red heart? Okay, so see how the aortic arch, I've drawn it really close to the heart. So it goes up and then right back down because that's what it looks like in your cat. So the aortic arch, you can't really see very well at all because it comes out of the top of the heart, but mostly it just goes straight down. It just zooms straight down. It's like a hairpin turn. It doesn't like go up for a ways and then loop down, right? It just, okay? So you can't really see the aortic arch, so it's not going to be on, not the arch anyway, is not going to be on the practical exam, okay? But I do want you to know some of the arteries that come off of the aortic arch, right? So if you notice now, looking at the red picture, does it look symmetrical?
Not really.
No, not so much, right? It is not symmetrical. So there's this collection, there's this big artery with a bunch of other arteries branching off of it, and then there's a smaller artery, right? So the big one is called the brachiocephalic artery, right? Why doesn't it say right or left there? Because there's only one of them, right? So there are going to be vessels where you don't have to say right or left because there's only one. So in the case of the brachiocephalic veins, you have to say right or left because there's two of them. In the case of the brachiocephalic artery, you just say brachiocephalic artery because there's only the one, okay? So this is the brachiocephalic artery, right? Now in my little drawing, the way that I've drawn it is I've shown it like, it's kind of exaggerated, right, in my drawing. But in the drawing, you'll see that there's three vessels that kind of branch off of that, yeah? And the way I've shown it in my drawing is that all three of those branches come off at the same point. It kind of looks like a bird foot, right? Birds typically have three toes and then one toe that points backwards. They don't have a pinky, right? So they walk like this, birds typically, okay? So, or two. I mean, it depends on the kind of bird, but whatever, okay? So, it kind of looks like a bird foot in my drawing. In some cats, it looks very much like that, where there's three things that are all branching off at the same point, off of the back toe, which is the brachiocephalic artery. In this particular cat, one of them branches off before the other two, right? So, one thing I want to say about the vessels, they've got latex in them, right? That's the same thing they make rubber bands out of, is latex. So, you can stretch them a little bit, but they will break at some point, because they're like old rubber bands, right? So, when you're tugging on them, and when you're kind of pushing the veins out of your way to see your arteries, just be gentle, okay? So, pulling on the brachiocephalic artery, this is my farthest right branch. So
Right.
What is this?
Right subclavian artery.
Right subclavian artery. And then this one is my next
right
branch.
Common carotid.
So that's the
artery.
right common carotid artery. And then this one is the
Left common carotid
left
artery.
common carotid artery, right? So just kind of leave your veins where they are, and then just kind, because the arteries are all under the veins, just kind of figure out what's what, okay? So our two common carotid arteries and our right subclavian artery. There is a left subclavian artery, but it's separate from the bundle, right? So the left subclavian artery is the other good-sized artery that's coming off of the aortic arch, right? So brachiocephalic artery is what my probe is underneath. The left subclavian artery is what my finger is under, okay? So in this cat, her three arteries, they don't branch at exactly the same point, but they're pretty close. Sometimes they all branch off at exactly the same point. Sometimes one of them branches off well before the others, but it doesn't matter because it's still the names are still the same if you go from right to left or left to right. So don't panic if your cat looks a little bit different than that. Okay? So those are all of the arteries above the heart. Okay, let's go below the heart. So below the heart, if you just like take the apex of your heart and tip it up like that, you see that giant blue thing? Right there, what do you think that is? That's the inferior vena cava. Right? So the inferior vena cava, I wrote I-V-C, okay? Right, is under the heart, and it goes down through the diaphragm. There's the diaphragm. You can follow it along if you want to. Where did you go? Where are you now? Did you lose? No. No, you didn't lose all your latex that fast, did you? Now I'm curious why it's so sad looking down there. Oh yeah. There it is. Alright, so yeah. Burp, goes down to the diaphragm, passes through the diaphragm, right? And then it ends up, do you see this big blue thing in the back of the body wall? Still inferior vena cava. Inferior vena cava all the way down. Okay? The aorta is a little bit trickier because the aorta, you can't just like pick up the heart and be like, yeah, there it is. The way that it doesn't really matter which side you do this from, but I always do it on the left side for, I think it might mostly just be habit, but, right? So, if you go on the left side, your cat's left side, right? So this is the cat's left side. And I'm just literally pushing all of her guts over, right? So that I'm basically like looking behind her lung, right, what I will see is there's a pink tube. Do you see that pink tube?
Mm-hmm.
And if I take my probe and I kind of poke along this pink tube like this, just kind of gently, I'll see that there's a bunch of little pink vessels that are attached to it. So this pink tube is the aorta. Okay? And so, right, see the little vessels attached to it? Right? So the aorta is right here, and then there's these little vessels that are coming off of it. So that's the aorta. Okay? Now, one thing that you want to be careful about is you don't want to get your aorta and your esophagus confused. So let's find our esophagus for sure, right? So that we don't mess that up. Okay? So that's the trachea, yeah? We did the trachea last time, right?
Yeah.
So underneath your trachea, like we saw in the picture in lecture, how the esophagus is basically behind the trachea, right? If we pick up our trachea, the esophagus is the flexible tube underneath. Right? So what I'm holding up with my finger is the esophagus, and I kind of have to like rotate it to see it. Yeah, so that's the esophagus. And then my esophagus is also in front of the aorta. So my esophagus is right here. This big tube. So inferior vena cava is the blue tube. The pink tube is the aorta. The fat tube in the middle of them is the esophagus. Yeah? And then, which goes down to the stomach. Yeah? Okay. The thing about the aorta is, depending on where you are, the aorta has different names. So if you're above your diaphragm, we call it the thoracic aorta because it's in your chest. It's the same vessel, but if we're below the diaphragm, show me your abdominal aorta. When we're below the diaphragm, we call it the abdominal aorta. It's not well injected, so you can't really see it much at all. That's weird. Anyway, when you get below the diaphragm, oh, there it is. Right? Now, since we're in the abdomen, we call it the abdominal aorta. So it's not well injected, but it's right there next to the inferior vena cava. Right? So it's the same tube, right? But when we're above the diaphragm, we call it thoracic aorta. When we're below the diaphragm, we call it abdominal aorta, but it's the same tube. Okay? So vessels in the abdomen. The main ones that I want you to know about, well, the only ones I want you to know about, right? Let's start with the kidney because that's the easiest way to start, right? So last time you should have undressed your kidney, right? Taken it out of the retroperitoneal space, okay? And so that, what was this thing again? This little white tube that goes down, what's that called? Ureter, which goes to the urinary bladder. Okay? And then the other thing that's holding the kidney in place is... So the blue one is a renal vein. So this would be the left renal vein, because it's on the left side. And then the artery is a little smaller and harder to find sometimes. And it sometimes is kind of on the back. Oh, and it's not well injected, so that's part of the problem, right? So now what I'm holding up is that kind of pinkish skinny thing. That would be the left renal artery. Okay? So now that we know where those are, right, we can find a couple more arteries that are up a little higher, right? So look at the picture, right, where the renal are going, right? So above the renal, sort of between where the diaphragm is and where the renal arteries are, there's two other arteries, and they kind of make a V shape, right? And they are unpaired, meaning there's just one of each, and they are called the celiac artery and the superior mesenteric artery. And what they do is they go to the guts, right? So typically, the way that I find these is I literally just start kind of like scratching with my thumb right around in here until I celiac artery goes to the stomach and the spleen and like the pancreas, okay? And so if I wiggle it, right? So I'm looking at this top artery here. If I wiggle it, it's going to move the stomach and the spleen. Yeah? Now, on this cat, normally it doesn't separate this quickly. It's separating into the splenic and the gastric really quickly. Normally you see it as one artery longer. So normally you see an artery here and an artery here. And so it makes a V. This one is making a V and then another V. So it's kind of weird, but that's okay. Yeah? So celiac. All right? And then this one that's a little bit lower, it's the lower side of the V, is the superior mesenteric artery because it goes to the mesentery that holds the small intestine. And so when I pull on that artery, the small intestines wiggle. Yeah? The inferior mesenteric artery is way down here on the colon. So do you see this guy right here? That's the inferior mesenteric artery, right? That goes to just like above where the sigmoid colon starts is where it attaches, okay? Also goes through a mesentery, a double layer of membrane, okay? And then the only other thing on the list is know them if you saw them, okay? So since she has her gonads, since she has her ovaries, we can find them on her possibly, right? So that's an ovary, yeah? So do you see this little red? Yes. Right? That would be her left ovarian. So gonadal is generic. It's a generic term meaning, you know, to one of the gonads. So since we can see she's a female, we could call it the left ovarian artery. You could also call it the left gonadal artery if you were, you know, feeling lazy. And then that darker thing next to it would be the vein. It's not quite blue, but it's, yeah. So that would be the left ovarian vein is going right here. Right? Left ovarian artery. Ovary would be the right ovarian artery, and then the left ovarian vein is going over that way. Okay? If you've got a male, it's going to be an artery or a vein that are heading down this way because the testes are external. But we'll get that when we do a male. Okay? Poor little peanut. He was a young fella. All right. So I want to show you guys. I wanted to show you guys. So he's already got one of his testes has been disrobed, right? So I want to show you how to do it. So I'm going to do the other side too. Okay. So so in male cats, the testes, and this is humans too, right? The testes develop in the abdominal cavity, just like the ovaries, right? They develop inside the abdominal cavity. But right before birth, they descend through an opening in the body wall, right, in the abdomen, and they go to the outside of the body. So they're only enclosed by skin, right? So they basically end up on the outside of the body. Why do they do that? Why would you put your gonads on the outside of your body?
It's too warm on hot inside.
So it's temperature regulation, right? It's not because they're good. It's not because they're fun to look at, right? And they're certainly more vulnerable on the outside of your body, right? So the reason they descend is because testes cannot make functional sperm at body temperature, okay? And so when baby boys are born, right, in their first little exam, they want to make sure that both of his testes have descended, so they feel his little scrotum. So the scrotum is a term for it's a sac of skin basically, but it also has muscles in it, right? And so they want to check and make sure that both of his testes are inside there, because if any of them are still in the body, right, they got to keep track of it because they might have to surgically pull one down, okay? And the interesting thing about that is that for the first few exams of when you're taking your newborn to, those of you that don't have kids yet that will eventually have kids, it's a pain. You got to take that kid to the doctor like a million times in the first like couple months of their life, right? Because they want to keep checking things to make sure they're doing okay, right? And one of the things they're checking for are the testes still down there? Are they still there? Yeah, okay, right? Because the opening that they pass through, it takes a little while for it to close down, and they want to make sure that the testes haven't like snuck their way back up into the abdomen. Because if they do end up in the abdomen, not only are they not going to make functional sperm, but they also, it increases risk of developing testicular cancer. Right? So they want to make sure those testes stay down where they're supposed to, okay? So here's a testis, right? And it's interesting because the scrotum, first of all, keeps them away from the body so that they don't get too hot, right? But they allow the scrotum, it's kind of like an elevator, to pull the testes up closer to the body or dangle farther away. Right? And so for those of you that are familiar with shrinkage, right? When it's cold, things get a little closer to the body. Yeah? The reason you have that shrinkage, right? They called it shrinkage. It's a Seinfeld. It's a really good Seinfeld episode. Right? It's a good one. Right? So when they talk about shrinkage, right? What they're talking about is the scrotum is pushing those testes up as close to the body as possible because it's too cold for them. Right? We want to keep them warm next to the body. right? And then when it's super hot outside, right, in the middle of the summer, the scrotum, the muscles relax so they can dangle, right? So they can get farther away from the hot body and, you know, more breeze, right? Okay, so this is why if men are having fertility issues, one of the things they suggest is, and so the testes on the reason I said poor little peanut
Make
is
sperm
because
and
he's a
hormones.
teenager, and I can tell that because his testes are really tiny. He does not have grown-up testes. He got baby testes. Poor Peanut. Cut down in his prime. Peanut, your little tiny testis is not working for me here, buddy. So there's a bunch of layers of connective tissue that surround the testes to kind of protect it, which makes sense, right? Because if they're dangling outside your body, you know, you want them to at least be secure, right? So I'm cutting off some of that layers of connective tissue because I want to show you a structure called the epididymis. And the epididymis is this little thing that's on the side of the testis that looks like a comma, like it's kind of shaped like a comma, and to mature. So the sperm are produced inside the testis, but then they go to the epididymis, and that's where they learn how to swim, and that's where they wait until their services are required. That's where they hang out, right? So see how there's like a little round, like egg-shaped thing, that's the testis. And then you see how there's this little thing coming up the side like that?
Mm-hmm.
That's the epididymis.
Mm.
Okay? And his are extra small because he's a youngster. So if you had if we had a older male, right, this all of this would be a little bit bigger. Okay?
So then that
testis, epididymis. Okay? And then this cord, right, that's coming up here, is the spermatic cord. The spermatic cord includes several things. So first of all, it has blood vessels because they need blood. It has nerves because, you know, they feel things, right? So, and you know, do things. So, right, blood vessels, nerves, and then also the tube that carries sperm to the penis, and that's called the vas deferens or the ductus deferens. So all of that is in this package called the spermatic cord, okay? The opening where the testes descended, so remember they start off in here and then they end up out here. So how do they do that? They go through a little opening called the inguinal canal, right? And so his inguinal canal is right, so I'm at the top of his spermatic cord. His inguinal canal is right there, right? And so I didn't make that hole. I didn't punch that hole through. I just kind of found it with my probe because the inguinal canal can't close all the way, right? It starts off bigger and then it closes down, but it can't close all the way because you still need to have somewhere for those blood vessels and the vas deferens to go, right? So the inguinal canal stays, and then once you get through the inguinal canal, then you can see, here's the vas deferens. It's like a little loop that loops over the urinary bladder. So you see this little guy that loops over where the ureter attached to the urinary bladder. So that's the vas deferens or the ductus deferens. And then these are the artery and the vein, right? And so they're not injected, so I can't tell which one's which, right? But this is his vas deferens for that testis. And then his vas deferens for the other testis is over here. They kind of look like little bunny ears,
yeah.
right? On either side of the urinary bladder because they loop over the ureter, okay? And then they both head down that way toward the penis, okay? So now let's go back to the outside and find poor Peanut's penis. Okay, so once again, his is going to be extra small because he's a young fella. Okay, so just like in humans, right? Their penis is covered by a sheath of skin called the prepuce. In humans, we tend to call it a foreskin, right? But the technical name is prepuce, and it's there for protection, right? Just to keep things covered, right? And then many people in this country cut it off of their baby boys. Right? And there is no medical reason why that's necessary. And there's a really interesting sort of story behind how that became popular. So some of it is religious, just religious tradition. Some of it is other things. So anyway, the punchline is this, right? I gotta cut through his prepuce to find his penis because it's completely covered. Yeah? So I found a hole and I just kind of started cutting in it. Right? So here's poor Peanut's. Poor Peanut's penis. I know. You're super impressed. You're like, wait, what? There's nothing there.
Oh, he didn't even have a chance. Damn it. He didn't
Right
even get it
now,
on.
I know. Poor Peanut. Honestly, though, they don't get much bigger than that in cats. Like, this is smaller than a like full-grown male cat, but it's not much smaller. Right? It's not, you know, significantly smaller.
Oh, that's sad.
I know, it's sad. But it's small, but it does interesting things. Okay, so I'm going to tell you a story. So